webinar series. Our webinar today will discuss living well with and beyond a brain tumor. My name is Jillian Demas. I'm the Senior Program Manager here at the American Brain Tumor Association, and I'm delighted to introduce our speaker today, Elizabeth Sherwood. Ms. Sherwood is an advanced practice nurse with a master's in psychiatric mental health nursing and as an adult nurse practitioner. She has worked in oncology for over 15 years and currently coordinates the University of North Carolina's survivorship and integrative medicine programs in oncology. She also specializes in working with the UNC Neuro-Oncology program. Thank you so much for joining us, Ms. Sherwood. You may now begin your presentation.
And I would like to thank all of you for participating today, as well as the American Brain Tumor Association, for this opportunity to speak with you all. And hopefully we can learn some ways, both from each other and from today's presentations, about your goal of trying to live as functionally as possible, given some of the issues you may be confronting. I don't think that any of you would doubt that the diagnosis of a brain tumor can be a crisis. And many of you may be in early stages of the diagnosis and treatment, and some of you may be in the later stages. And there are oftentimes different issues that come up depending on where you are in your treatment. And we're going to try to address a few of those today, as well as hopefully have time for your questions afterwards so we can approach what the issues are that you are finding most in need of answers to. We do know that as you move forward with this time in your life, that we are fortunately being able to report better outcomes. But despite outcomes, we do know that there may be side effects of treatment as well as late-term effects of treatment that can impact and provide challenges that are new both for you, your caregivers, and your family. What may be challenging can be different depending on the type of tumor that you have, the type of treatment that you had, your age, as well as where the tumor is located. Many of you, I'm sure, have looked up to find out about the type of tumor that you have and where it's located. And what we do know is different parts of the brain can then be impacted, which may impact things from personality to mood to mobility and to a variety of issues that can present problems not only for you, but also your family. So we're going to talk a little bit today about finding your way, and I am hoping that today's presentation can be helpful both to patients and caregivers, as some of the information is going to apply to both of you, in that we know that this is a new set of challenges and there may not be a roadmap that is easily provided to you. So how do you decide where you want to go? We do know that for many people, cancer has a way of putting things in perspective. Things that seemed very important before may not be as important, and things that weren't as important before may have new meaning for you. But at the beginning of your treatment, as well as sometimes longer term into treatment, there can be a variety of challenges, and there may be people that you find that can be helpful. I know that there's helplines through the American Brain Tumor Association and blogs that can be one source of support. But for many people, it's really uncharted territory, and it's like finding your own way in a new country and with new language, and that can be in itself very stressful. We do know that a diagnosis with a brain tumor can be something that is particularly jarring, and that many people, both patients and caregivers, can experience anxiety and fear and worry. There may be difficulties with sleep, and there may be challenges in thinking about where this cancer is going to lead and what your future looks like. Many of these things are challenges for you in terms of how you see yourself as a professional, how you see yourself as a parent, and how you see yourself as a partner. We do know that emotional distress can be quite high at different points during your treatment and as well as after treatment. Oftentimes people are surprised by the distress that is experienced when treatment is complete. But what we also know is that if emotional distress is not addressed, if you're not letting your healthcare team know that you are suffering from depression, or if you're worried and such that you're not sleeping well, that it can actually negatively impact not only your quality of life, but how well you do day to day, and also your ability to adhere or take part in your treatment as fully as that might be. And that might be during your active treatment phase, during radiation, as well as if you're needing to participate in rehab post-treatment. So I do want to encourage you all, if you're noticing challenges with mood, to discuss that with your healthcare team. That can be something as a family member and a caregiver that also can be particularly challenging, as some of those mood changes might be reflective of where your tumor is located, and so it can be challenging because what might be considered apathy or not wanting to do things may be in fact in part because of where the tumor is located. It is impairing one's motivation. And you can understand where the importance of understanding where the tumor is locating and what kind of impact that might have on personality can be very, very difficult for the family if there's not that understanding, as well as for the patient. Many times, and with many types of cancers, we do know that there is a way to foster your well-being and your sense of resilience. There is one way of becoming very active in your health care plan. Sometimes that may be the patient and sometimes the caregiver, and ideally it's both. Taking control of your health can mean being prepared with questions, knowing who to go to with your questions, and finding out from different resources, whether that be online with the American Brain Tumor Association or through the cancer center that you're being treated, where to go if you do have a problem but don't know the answer. We do know, as I mentioned before, that there are many, many emotions that come up during this phase. We do know also that many people fear talking about these intense emotions because they are thinking that they're the only ones who are experiencing them. I can assure you as a professional, one of the things that I often do is assure people that what they're experiencing is experienced by most people who are dealing with a diagnosis of a brain tumor or concerns about what will be the next step. And so it can be very reassuring to let people know what is going on. When we try to hold this in, it can lead to other areas of difficulty, and I'm going to address that in just a little bit. We do know that increasing your positive emotions can also be very helpful. And what I mean by that is not that you're just supposed to be positive all the time and that you're supposed to deny what is going on. What I mean by that is if we can look for little glimmers in our day of things that we're grateful for, or if we know, for example, that we enjoy spending time with family or friends, that we acknowledge our gratitude for that, it can help us to not only feel better about our day-to-day experiences, but it also can help us to increase our positivity. And there are definite benefits to feeling more positive, both from a neurological perspective and a physiological perspective, and of course from an emotional perspective. We also know that social support can be very important. This can be a challenge when you've been diagnosed with cancer. Sometimes friends that you thought were going to be there aren't, and sometimes you can be surprised by the people who do rally around you. But there are many avenues for social support, and once again, that might be through a support group, it may be through a church or a spiritual group, And I encourage you all to realize that sometimes getting through this on your own or with just your caregiver can be particularly challenging for both of you. And so expanding your social support may be something that is helpful. Another area that has been demonstrated to foster resilience is deepening your spiritual connection. For some people, this may mean their church family or their religious affiliation and deepening that connection. For other people, it may be a regular walk out in nature or to listen to their music that touches their soul. But what we do know is when we can increase our sense of connection to the world and for what we consider bigger than just us, it helps in terms of fostering resilience. And another area that has been demonstrated with research is the sense of purpose or the reason for living. For many people, this can be family or it can be certain events. It can be your desire to give back, to know what you received during your treatment and to become an advocate for other people going forward. So as you can see, there are many different areas that are important and helpful in terms of fostering your well-being. But what we also know is that one of the most common things that gets in the way of all of this is anxiety. And anxiety can be particularly difficult to both pinpoint, to acknowledge, and to figure out what to do about it, given all that's going on. Everyone is different in how we deal with anxiety. I'm sure we all know people who we can say, oh, they're an anxious person. But others of us may experience anxiety by having headaches or being more physically agitated or active. We may have sleep disturbances, or we may just be tense. And what can be particularly challenging, too, with anxiety is that it's oftentimes related to fear. But if we don't get in touch with where that fear is coming from, anxiety is a global experience, and therefore it feels harder to get a handle on. So as I was speaking about earlier, figuring out your way, charting your way, can be something that is very helpful in dealing with your anxiety. Being able to figure out if it's going to the hospital because that reminds you of certain events, or if you're someone who you know that needles or procedures is particularly challenging, figuring out some of those areas can then help you prepare so you feel like there are ways to deal with your anxiety. We do know, of course, that the diagnosis of cancer opens many doors that are related to the fear of vulnerability, the fear of pain, the fear of death, the worries about what may happen to your family. And of course, these are much bigger issues, and they are much more challenging in the face of being tired, perhaps, or recovering from a surgery. And what we do know is at different points in time, you may be more comfortable in talking about this or dealing with it. And what I do encourage you to think about is that it's not something to necessarily push away, but it's something to share with your loved ones, with your healthcare team, so that the resources that we know that have helped other people at this time may be made available to you too. Oftentimes, people will struggle with depression. Ongoing worry and ongoing anxiety can lead to depression because of sleep disturbances. And as you can see from this slide, where there is some in the red and some in the black, is that many of the things that we have associated with depression in the guise of someone with a cancer diagnosis can also be very much related to both the cancer and or the treatment. So, for example, we know that many people have to take steroids to deal with the swelling from brain tumors. We know, for example, that steroids can lead to sleep disturbance and they can lead to agitation. They can lead to a whole host of problems with mood. So it is important to understand that there are oftentimes physical aspects that go into causing a person to look depressed, as well as mental and emotional aspects. When you are noticing that you're feeling particularly guilty or particularly worthless, or that there are feelings of lack of hope, that oftentimes is a good indicator that it is more important to address this, to let people know. And one thing I do want to encourage you all too is if you notice yourself or you notice your loved one experiencing more than just a few days where it's hard to see a glimmer of something good, then that is the time to let your healthcare provider know, your oncologist, or if you do have a good relationship with your primary care doctor. So this can be addressed before you feel increasingly depressed and have a harder time shifting out of that. And as I mentioned before, it could be depression, but it could be lots of other things. We do know that some of the medications that are given, for example, some of the medications that are given for nausea, particularly compazine, if taken in higher doses, can cause some people to experience a motor restlessness, or as you see on the slide, akathisia, which can seem like irritability to some people. So it is why I'm encouraging you all to talk with your healthcare provider if you are noticing things. Likewise, for many patients who have had brain surgery and brain radiation, there may be a heightened sensitivity to some medications to cause a delirium. A delirium is something that happens and can be very confusing for the patient as well as the family member. The patient may be talking in a nonsensical way or may be more confused. And once again, this can be caused by many medical problems, and it's an important reason to call your healthcare team. These kinds of stressors, as you can understand, make it particularly challenging for you all in finding that quality of life that I know you're striving for. Many people expect depression to look like someone who's just lying in the bed or oftentimes tearful, but once again, people can be very different. It may be irritability, or as some people say, snapping at people when they talk, or just not happy about anything. These are some of the ways to identify the difference between depression and the physiological challenges I was talking about previously. So we're going to talk about ways to, once again, foster that resilience and that sense of well-being. Seeking solutions and being an active participant in your health care and what you feel like you need to move forward is one of the ways that can definitely help one feel more empowered and more of a sense of being in control. And we do know that for many, many people, one of the biggest challenges with the diagnosis of cancer and coming for treatment and perhaps waiting for treatment is that sense of a loss of control. It can be very unsettling for people. And so this can be one of the means of feeling like you do have some control in a situation that may feel very awkward at times. We also do know that if you're experiencing ongoing issues with anxiety and mood, that for some people there are some medications that can be helpful. Medications may be helpful for some, and for other people it may be pursuing other means of dealing with well-being and mood and helping with things like fatigue and how you feel, as well as sleep. As you can see on this slide, quality of life is impacted by many, many different areas in our lives. And one of the ways to think about how to move forward at a time such as this is to think about these different areas whether it's physical well-being and symptoms, or social and family relationships, psychological concerns, and spiritual concerns, and to sort of identify in which of those boxes are you feeling most challenged by currently. And then you can narrow down what some of your choices may be. So one of the things we're going to talk about today is how to begin to do that. We do know, too, that more and more of you are living longer after the diagnosis of a brain tumor. So your challenges may be different. There may be some later or long-term effects that people notice after years of treatment, and I am going to discuss those briefly because those too can be improved by getting in contact with your team and finding out some ways of moving forward. We do know some of the late and long-term effects of radiation may be challenges with cognition. Some people will find that they have returned to work, but their ability to multitask or the flow of work as they experienced it before is more challenging. There may be problems with your endocrine system, particularly if you received radiation. One of the areas that can be challenged is your thyroid gland, and so you may have thyroid abnormalities. Additionally, there are vision and hearing changes that can also be from the radiation, but there are many doctors who benefit, who are very good in terms of working with your neurologist, your neuro-oncologist, that can help with these sorts of issues. Likewise, some late effects of chemotherapy can be elevated blood pressure, as well as muscle and joint pain, and once again, some memory issues and that sense of chemo brain that you hear more and more about, as we have identified it as being something that many people do experience. So we're back to figuring out your map, figuring out your way of moving forward at such a difficult time. Ideally, there have been some respite from the challenges from the very beginning. But one of the big things that we know, whether you're in active treatment or afterwards, is that it oftentimes feels like you're having to figure it out on your own. So as we move into that phase, I want you all to consider, where is it that you want to go? What is it that is the most problematic at this time? And where do you want to put emphasis to help both how you function day to day, whether that be from a physical perspective, whether that be from an emotional perspective, whether that be from a spiritual perspective, and how might you make choices to begin to plan to do that in a way that brings you a better sense of well-being and a sense of being more connected to both your family and to a purpose, a sense of meaning. Taking control of your health. If you remember back in the previous slide, we talked about those things that we know help to foster resilience and well-being, and one of those is taking control of your health. More and more in the cancer setting, we are working to try to help patients at the end of treatment get an idea of what their treatment summary was and a care plan. And what I mean by that is it is a document that helps for you to understand what your treatment was, as well as what some of the side effects that you may notice, both short-term and long-term, and importantly, what your follow-up will look like. We haven't been so good in the past of letting patients know from time to time, meaning that we'll say, oh, well, I'll see you again in 3 months, or at this point you'll have an MRI. So part of that idea and part of the way for you to be proactive is to get an understanding from your physician at the end of your treatment what your surveillance will look like. Part of the reason that this can be very helpful is it will let you know, for example, when you're scheduled to have MRIs or when you're scheduled to have scans. We do know for many people after their treatment is done, that those surveillance scans, for example, can be a time of heightened anxiety. So what I'll say to many people is make sure that for 3 or 4 days or even the week before your scan, you're doing things that you know help you to feel less stressed, or that you have some sense of calm, so that by the time that you get to the scan, you're not exhausted emotionally. Likewise, it's not uncommon for many people after treatment to worry about everything in terms of, is it a symptom or an indication of my cancer coming back or my cancer progressing? Those are all good questions for your healthcare team at the completion of your treatment. Which symptoms should I call you for? When will I call you if I experience such and such? And that helps you to feel empowered and that you have more information to take control of your health. Likewise, for many people at the completion of treatment or during treatment or even intermittently during times of healing and recovery, there can be great advantages to participating in rehabilitation services. These may be actual rehabilitation services. It may also be through different wellness centers or different programs, opportunities to take part in physical therapy or speech therapy. Exercise therapy is becoming a more and more commonly held program at many cancer centers as more and more research indicates the benefits of physical activity and exercise, and I'm going to address that a little bit later. As well as if you are noticing, as I have mentioned before, that the cognitive concerns or the emotional concerns are really causing a lot of worry or difficulties in relationships, then it is time to find out what is offered, and if things aren't offered, to make sure that you let your healthcare team know that you think it would be a great idea to offer something like that at your institution. I will assure you, as someone who's been working on oncology for over a decade, that it is oftentimes patients and families that bring up, this is what's needed, this is what we would like to see here, that do help those things then to happen at your cancer center. We do know that there are some general principles that can help people to feel better, to sleep better, and I'm going to address some of those now. As many of you know, there has been more and more in the both popular media as well as in the research literature to the benefits of eating well as we change our diets a little bit from processed foods to foods that perhaps are fresher. That's, of course, easier to do in the summertime, at least for most of us. And I know it can also be very confusing because there's information about not doing this or not doing that. And I think that if one of the caveats you can remember is to try to eat more fresh fruits and vegetables, and to try to choose healthy proteins. And by that, what I mean is we do know that there's more literature that indicates, for example, that processed meats are probably not great choices, that is a way to begin to implement some dietary changes that we all can do. I know that I teach a class called Cancer Transitions that's for folks after treatment. And one of the things I commonly say to folks is, you know, if you pick up any food item that you're going to eat and you look at the list of ingredients and you can't say correctly or know what more than 4 of those ingredients are on the package, it's probably something to think twice about. We do know that making changes in your diet should not be something that just is all or nothing at one time, but it's doing slow, steady changes so that, for example, if you know that routinely you have 1 serving of vegetable and maybe 2 servings of fruits a day, that you say, well, I'm going to try to eat 2 vegetables or 3 fruits. That doing things slowly and steadily will definitely help it to become part of your whole plan for moving forward with health, and also is not something that doesn't resonate with you. It's important for you to feel like the choices you're making as you move forward make sense to you and you enjoy them. And in that light, for example, with food, it can help to think about food from many different perspectives, from the color, the textures, the appearance, and being mindful of all that goes into bringing that food to your table. When I was talking about positivity before and expressing gratefulness, I think that one of the things I know I learned from one of my participants in my group was that she just took a minute to think about all the things that went into bringing the food to her plate and express some gratefulness to that process. So little things like that can help you to not only enjoy your food more, but also to appreciate the benefits and the fortune that we have to be able to have so many delicious options on our daily plates. I will assure you that I've heard from many people that I've worked with that physical exercise is a dirty word. And if you're finding that about yourself, I'd encourage you to think of it as movement or activity or a way of being able to help you do more of what you want day to day. One of the side effects that people with brain tumors often experience is fatigue. And while I know it seems very difficult to understand why fatigue would be benefited by physical activity, we do know, in fact, it is one of the things that helps. We do know, too, that physical activity can help to increase your mood, as I mentioned before, and reduce stress. Additionally, for many of you, if you did take steroids, one of the things that we know about steroids is it can cause some decrease in muscle mass as well as some changes in the strength of your bones. And so long-term, especially physical activity, can help to regain that muscle mass and to improve your bone strength. So it can be particularly helpful to you all to incorporate that. Likewise, I know that it helps with sleep. And as you can see here, we know it also helps with blood pressure control and cholesterol levels, which, as I mentioned, is oftentimes a problem for many of us, but can also be a delayed or late-term effect from some of the treatment that you've received. So you can see that it can be helpful on a variety of levels. Just like I was mentioning before, it's important to start where you are and to think about incorporating physical exercise or more movement in a way that you would enjoy. If that means walking down your driveway a couple of times with the dog or to get the mail, it may be as simple as that. But it can be something that all of us can find ways of increasing and also benefiting us. One idea is for people to get a pedometer, which is a small little thing, and now of course there's Fitbits and all different kinds of ways of measuring it. But what essentially it does is it measures your steps. The benefit of using one of those is you can wear it for the first couple of days to just see where your average is. If you're only doing, say, 3,000 steps a day, thinking that you're going to go from 3,000 steps to 10,000 steps in a short period of time may be an unrealistic expectation. But you could say that you're going to increase it by 100, for example, each week, and then therefore have some success in what you're doing. I encourage you all to think about this as also something you can do with your partners, with a family member, or finding someone who might want to do it with you. Because what we do know is that this is one of those areas where having a buddy or having someone else who can help us accomplish our task can be really something that's quite helpful. There are a variety of techniques to get in more exercise and more ways of strengthening your muscles. For some people, they like to incorporate exercise that also helps them to relax or to improve their stress reduction. Yoga is one of the areas that we have more and more research on in terms of helping to improve fatigue. One of the benefits of yoga, too, is that it can help with balance. And for some of you, you may notice or know about yourself that balance is one of the things that was impacted by where your brain tumor is or some of the side effects of the chemotherapy. Ideally, you'll find yoga teachers, whether they're at your cancer center or associated with a wellness program, who are familiar with people who have been in treatment for cancer and therefore can work with you in a way that both helps you to improve in the areas you can improve and for you not to be in a situation where you're doing exercise that you don't consider helpful or are worried about. Pool exercises can be great for people if you have joint aches and pains because it takes the weight off of your joints and it allows you to exercise, and water for many people in and of itself can be very soothing. I also want to point out for those of you who are feeling like you can't do a more active exercise routine that there are many ways of improving muscle strength by sitting in a chair and using TheraBands and using stretches, and oftentimes there will be a physical therapist or even just a handout that can help you to do this. It, as I said, does lead to many benefits that go beyond just thinking about it as being exercise. Another area that you, I'm sure, have heard more and more about because it is increasingly in the common or the popular media and increasingly in research that we are receiving on the medical level is the benefit of mindfulness, which is a form of stress reduction that encourages the individual to practice in a certain way that I'm going to discuss in just a minute. Mindfulness was first used way back in the 70s for people who were dealing with heart issues or cardiac issues, and was found to be very helpful in terms of decreasing blood pressure, etc. But now, over these last many years, we are seeing it helps in more and more ways. And as you can see from this slide, some of those ways that it helps are increasing one's sense of vitality and life satisfaction. Again, as I mentioned, positive affect and your sense of being able to feel connected and competent in your daily life. Interestingly enough, too, we know that many physical symptoms respond to the practice of mindfulness. It has been shown to help decrease pain, to help improve headaches, and so we know that its benefits are far-reaching. When people think of mindfulness, for some, they may know this as practicing a breathing exercise. For others, it may be practicing a centering exercise, and what I mean by that is it may be repeating a certain phrase over and over. It may be reading something that is of importance to you. For some people that may be scripture, for some people that may be poetry, and allowing yourself just to focus on that. But in general, what the premise of it is that you are allowing yourself a period of time. For some people that might be 5 minutes, for some people it may be a longer period of time, where you are engaging in relaxing and breathing slowly and trying to keep your mind from wandering to all sorts of places. It is an exercise in self-compassion, in that for most of us, that's a difficult thing to do. We may stop and then we think about what we need to put on the list, or we may stop and then begin to worry about something. And it's slowly practicing bringing your attention back to your breathing or bringing your attention back to the quote that you were using as your guide. For other people, they may actually listen to guided meditations. So this is an area where there's lots of different ways of doing it. There are some great guided imagery meditations and guided imagery choices on the internet that you can find. I do know that there's one resource called Sounds True Recordings that offers quite a few options. But what we do know that the practice of this, as you practice more and more, just beginning the practice actually helps that relaxation response to begin. And so there is benefit to trying to practice it regularly. And we do know that this is another one of those techniques that you might choose on your map, if you will, to help you move forward with a heightened sense of being able to be proactive about your care. We do know, too, that it can help with that sense and that opportunity to reflect on what is important to you, what is going on, and help you to plan on how to go forward. Just a few more things to think about before we begin to take some questions. As I mentioned, is the importance of social support. This is a difficult time often for both the patient, the caregiver, the family, and we do know that social support is an important variable, if you will, to consider as something that can be helpful. It can look very different for each one of you, and the importance is to figure out for yourself what you want that to look like. It may be conversations on the phone or by email, or it might be in person. But to know that all of us derive strength from others that we feel care for us is something that can be helpful. Humor. I could give a whole talk on humor, but we're addressing obviously many things that can be helpful, and part of my goal today is to give you options for you to choose which one of these things might be helpful to you. We do know that humor has physiological benefits. It helps you breathe better. It increases oxygen. When it's that good laugh, as we all know, it helps with relaxation. It helps us to feel connected. We do know from research that there's changes in hormones and neurotransmitters. That can be laughing at a movie. It can be laughing at jokes. It can be laughing at funny videos. But it is something to think about incorporating into your day or your week to help your sense of well-being. And before we stop, there's just a few other areas that I'd like to address. Touch. Many of you have been in a hospital environment where you've had surgery or you may have had blood draws. There's lots of intrusive touch that goes on, and I am someone who greatly believes that if you're inclined towards touch that is more rewarding, that there are different ways of receiving that. Massage is something that I know we offer at our cancer center that many patients find helpful in terms of the healing process. We do know that touch helps us to feel cared for and that it is very important for our sense of well-being and our psychological growth. So that is something to incorporate, as well as communication. And many of you may be listening to this with your partner or with your caregiver, and we do know that communication, once again, can be a challenge. That can be a challenge not only from where your brain tumor is located, if that is one of those areas that makes communication more challenging, but also because this is just an emotionally intense time, and you've never been here before. It may be very tricky for couples that weren't used to talking about such things in such a fashion because it's a new behavior, and with all that's going on, that can feel overwhelming at times. But we do know that being able to acknowledge that this is new, you haven't been here before, we don't know how to do this, but we're going to try to figure it out together can be something that is quite helpful. And it also takes the right and wrong out of the situation. It's that we both are trying to figure this out together. So what I'm going to encourage you as we come to an ending here is to allow yourself to give some time and some reflection about where you are right now and what you think might be helpful going forward. If you have an idea about what some of those things are, is seeking out resources or referrals from those people either on your healthcare team or at your cancer center or through the American Brain Tumor Association. There are lots of ways of finding out the resources that are available for you. And for those of you who are listening today who might be located in more rural areas or where the resources might not be so easily available, to know that there are ways of linking you with some of these resources, whether that's through the internet or over the telephone, so that you don't have to feel like that is not available to you. As we close, I do want to thank all of you for participating, and also to the American Brain Tumor Association for this opportunity for us to be able to now have some questions. I do know that I have a couple of resources that will be listed here and that you also will be able to find later on the website when they're posted. Many of them are through the American Brain Tumor Association, so you'll be able to find that. As well as I did list some resources for young adults, as I know that young adults who are dealing with a brain tumor diagnosis can be particularly challenged. And one other last resource that I would like to mention is the cancer support community has a great booklet that is on brain tumors that does talk about both the physiology of it and some practical concerns, and the cancer support community can also, that might be available in your resource center, and so that can also be another resource for you. Thank you.
Thank you so much. That was wonderful. My colleague and I were here taking notes, so thank you so much. We do have time for questions, so as a reminder, if you have a question you'd like to ask, just type and submit it using the question box in the webinar control panel on the right-hand side of your screen. We do have some that were pre-populated from the registration process, so I'm going to start with those. Someone is talking about the immune system and how hard it is to keep the immune system so strong through all of this with low platelets. Any suggestions on how to keep it strong through all the different challenges? Any tips, any techniques? I know you talked about eating well. Anything else beyond that?
I think that's a great question, because we do know the immune system is something that is obviously very much challenged during treatment, and it is something that we know can be fostered in a variety of ways. As I mentioned before, there is more and more research with the benefits of practicing some mindfulness techniques with aiding the immune system. So that might be one thing to think about. And as I said, that can be something as simple as doing a breathing exercise for 5 minutes, maybe once or twice a day, or downloading some of the guided meditations. One of the challenges during treatment from a nutrition standpoint, which can of course also help the immune system, is that there may be appetite concerns, or if your counts are challenged, they may be encouraging you not to eat fresh fruits and vegetables, but to know that there are ways of still getting some nutrition in that way, depending once again on appetite. Many cancer centers have nutritionists available or have resources in their cancer center resource room or their patient and family resource center. So that might be another option, is to see what might be available from a nutritional standpoint, and to then check with your hospital dietitian or nutritionist. And I do know that that can be a challenge, and the platelet counts, of course, is something that both you and your healthcare team are concerned about. And so making sure that you ask them, too, what might be helpful.
Great. In addition to healthy diet, you know, I'm not sure you can go there. Someone's asking about recommendations of supplements that you can recommend with memory problems, fatigue, and nausea.
There are a variety of supplements, and this is one of those kinds of areas that there are some mixed thoughts about the use of supplements. How I like to think about that is, if you are in active treatment, meaning you're receiving radiation or chemotherapy, then you definitely want to check with your radiation oncologist or your neuro-oncologist, because there can be some interference or some difficulties with supplements. I think that for many people, depending on your particular brain tumor, if, for example, there has been some research done with ginseng for fatigue after chemotherapy, many people will go for an integrative medicine consult. I know we have a physician in our cancer center who specializes in that. That is one option. After treatment, I do think that there are oftentimes wonderful resources in terms of working with an acupuncturist or working with some integrative practitioners who are well versed in treating people with cancer that can be very helpful. One caveat that I like to say about supplements, if anybody is trying to give you a substance that is going to take care of everything, then it's probably something to doubt. But I do think that there are many integrative practitioners who work well with people after they've been through treatment to help with that restorative healing process. Oftentimes, this might be something that is done through discussion with other people in your community. I'm not sure if I know that the American Brain Tumor Association actually had a publication about 2 years ago, if I remember correctly, on many integrative therapies that have been found helpful for people after treatment. Also, really good nutritionists are going to be able to help you with the supplement question, and if there are particular supplements that might be helpful after certain chemotherapies or after certain cancer diagnoses.
Thank you. Yeah, we did have a webinar with Dr. Mary Hardy, which is under our Anytime Learning section. So thanks for that shout out. Someone is asking about different kinds of water. So is one kind of bottled water better than the other?
You know, that's probably always a good question. I do know that just a couple of years ago there was a study done that demonstrated that some bottled waters were really no better than tap water. I think for, of course, the drinking water and staying well hydrated can be something that is very important for fatigue, for headaches, for a sense of well-being, and so drinking water is very important. I think if you live in a community where there is a city water system, that one of the benefits of that is they all do have to have a report on your water quality, and so if you are concerned about what might be in your water, that is definitely one place to go. Or if you know that your water, in terms of the taste of the water, is something that you don't like, then perhaps a bottled water is something that is an option. I think that the whole idea of bottled water is a little tricky in that some of that is just challenging because it's probably not any better than your tap water depending on where you live. And I do know that drinking water as well as drinking beverages that help to hydrate you is what is important to do. And so I encourage you, if you do have concerns about your local water supply or you're wanting bottled water that's from a larger distributor, like, you know, the larger bottles versus just the individual serve bottles, then that's something to look into in your particular community.
Great, thanks. We have time for one more question. Someone is worried about exercise after the Decadron osteoporosis kicks in. Any recommendations of how they could still exercise?
Yes, I think that it's a great question because we do know that osteoporosis is something that can be very challenging and thereby something that both we know that weight-bearing exercise is actually helpful in terms of the slowing any kind of progression of osteoporosis, and so that is where it can be important. But depending on what you know about your bone strength, that is something that if you are worried or you've already been diagnosed with osteoporosis, to know where your bone strength is important so you're not doing something that would be harmful to your bones. But for example, when I mentioned the yoga, there is a doctor that's up in New York who has done increasing amounts of research with certain yoga poses that can actually help to benefit osteoporosis. We know that walking is one of the most helpful activities that can help with osteoporosis. The challenge is if you're having pain, to make sure that the pain is addressed so that you're not causing more pain that's then causing you to be more physically active. It doesn't have to be running, it doesn't have to be vigorous exercise, but routine weight-bearing exercise can be helpful. And if you're worried about more vigorous exercise, it may be where doing some of the movement therapies like yoga can be particularly helpful.
Great. Thank you so much. It was so informative. We really appreciate it. That's all the time we have for today. For more information on any brain tumor topic, or if you didn't get your question answered, you're always welcome to call our care line at 800-886-2282, and our licensed healthcare professionals, social workers, and nurses will help answer your questions and navigate our site. So we're going to just pause for a moment while we conclude our webinar recording, and then we will talk to you about our next upcoming webinars.